Good afternoon. I'm the Reverend Charisma Jean-Marie, and I serve as the Director for Racial Justice Ministries at Scarritt Bennett Center in Nashville, Tennessee. And we are so grateful to have you join us again for another live stream conversation. And we're excited to partner again with one of our sister organizations, Meharry Medical College, as they come to share the conversation entitled COVID and the Holidays. You know, COVID is a hot conversation right now for so many reasons. One, we see the numbers are spiking again. I don't know if it's even again, it hasn't stopped spiking, particularly in Black and Brown communities. And now we have the holidays, and so many people this year has experienced so much loss and grief, experiencing grief this year alone. And now we have holiday blues. So it is important for us to come as, you know, an organization that's been in conversation with you all year long around justice work, to come and share with you ways that you and your family can be safe during the holiday season. So we're grateful to bring you this conversation. As we partner with Meharry Medical College. We have some of the best who's been in the front line, some names you will recognize, who has been doing this work in our community. I often say they smell like the people because they've been with the people. You know, there's a whole lot of people who's talking about the people but don't know nothing about the people. That is not the case here with our panelists. Our panelists has been in the front line in our community, supporting the wellness in our community. So we're just honored to have them this afternoon. As we get started, I'm going to start with Dr. Julia Gray, who's been leading the COVID testing site, the Nissan site. She'll come share a little bit about who she is and what she does, and also talk a little bit about testing and the status of testing right now as we move into the holidays. Dr. Gray, thank you for being here. And again, just want to turn it over to you that you might share a little about who you are and what you do and COVID-19 testing. Welcome.
Absolutely. Thank you. It's a pleasure to be here today and talk about COVID-19 as we approach our holiday season. I am Dr. Julie Gray. I'm the Assistant Dean of Student Affairs at Meharry Medical College School of Dentistry. I also serve as the site leader of one of our community assessment sites at Nissan Stadium. I'm pleased to be amongst my colleagues today for us to have an open, candid discussion about COVID and the holidays. COVID-19 is caused by the SARS-CoV-2 virus. Its principal mode by which people are infected with this SARS-CoV-2 virus is simply through exposure to respiratory droplets. These respiratory droplets carry this infectious virus that we know has just plagued our community just for this entire calendar year. These respiratory droplets are produced when we exhale, when we do simple quality of life functions, when we breathe, when we talk, when we sing, do things that we enjoy, when we cough, when we sneeze. And we talk about the way that this virus is transmitted. It's transmitted by three different ways: contact, droplet, and air. And you hear a lot about ways that we can prevent this virus. We talk about wearing a mask. We talk about social distancing. We talk about washing our hands. And I think some of us have COVID fatigue because we hear those things ad nauseum. Well, why? Why do we hear those things ad nauseum? We hear those things ad nauseum because, around the 4th of July, there was a peak in our community. Then around Thanksgiving, there was another peak. We're all bracing ourselves as we move into the Christmas holidays, because we have to make sure that our community is guarded with being sure that this respiratory virus and the way that it's transmitted, we're vigilant. Wearing a mask not only protects yourself, but it protects others as you do these normal quality of life things. As you breathe, as you sneeze, as you cough. So you've got to be vigilant if you plan on traveling over the course of the holiday. in the car with someone who's not a member of your family, you need to wear a mask. If you go over to someone's house who's not a family member, you need to wear a mask at all times. Normal quality of life things like going to the grocery store, going to the post office, you need to make sure when you come in, you are washing your hands, putting your groceries on your countertop. You need to ensure that you're cleaning your surfaces. Going into the elevator, into different buildings, you need to make sure that you're washing your hands or using hand sanitizer. Those are all ways that you can, on a day-to-day basis, protect yourself from this virus. In addition, we mentioned COVID testing. I am the site leader at the Nissan Center at Nissan Stadium. COVID testing is very important. We at Meharry Medical College have been at the forefront of testing since its inception. We've been there. We've got 3 different assessment centers. We've partnered with Metro. Our community assessment centers are located on our Meharry Medical College campus at Nissan Stadium, and as well at the old Kmart. Testing is very important. You ask who should get tested? Everybody should get tested. We should test 1-month-olds up to 100-year-olds. And exactly why should we get tested? We should get tested because there are many, many asymptomatic carriers. Probably over, well over 50% of our population could potentially be an asymptomatic carrier. You know, there are many people that are coming to our testing centers that do have symptoms. They could be in contact with someone. We talked about ways that the virus is contracted. One of those is through contact transmission. So coming to get a test is very important because you could have come into contact with someone who has become positive for COVID-19. Getting a test is showing your simple love for your neighbor is something that I say at all times. We as African Americans have to understand that it is our love for our parents. It is our love for those who are vulnerable to make sure that we get tested. My mother, and I'm very, very candid about this, lives with me. And I test often myself because she is in that bracket. She's got hypertension, she's got diabetes. And although she has not left this house on many occasions, I know that my husband and I are both healthcare workers. And it's potentially that we could bring something home to her. So that's one of the reasons that I test often. So you have to make sure that you test often because of these reasons. What are the type of tests? I think that was another question. Type of tests, we here at Meharry Medical College are administering the nasal swab test. I know a lot of questions that come by, people still are saying, are you giving me that test that goes all the way to the back of my brain? Absolutely not. That is not something that we're doing. It's just a simple nasal swab. It is in both sides of your nostril. But it is very simple, a couple of twirls on each side of the nasal cavity, and it's done. Right now, results are 3 to 5 days. There are other kinds of tests. There is the nasopharyngeal test that was administered early on. There is also the antibody test that is also for people who have potentially had the virus in the past. And those are the sorts of tests that are being administered. But what I would like to say to our public right now is as we approach the holidays, it's very important that you get tested, especially if you're traveling to a home that's not yours. It's very important that we unmask this ugly virus where it is and call it for what it is. But if you don't test, you will not know. And it is basically a love of your neighbor. I tell my team every morning before we get started, I lead in with our mission, which my colleagues has behind them, worship of God through service to mankind, because that's what we do as Meharrians. But I also lead in with my team a simple be kind, do good, and love all, because that's what we do as Meharrians every day. And if you get tested and test often, that's what you're doing to your neighbor as a Nashvilleian, is being kind, doing good, and loving all. And that's what we need to do in our African American community. Thank you.
Wow, thank you so much, Dr. Gray, and we'll invite you back for Q&A. For our audience members that are watching, let me remind you, you are always welcome in this conversation. So please join in the conversation. You have amazing doctors right here, medical professionals who want to answer your questions. So questions or comments, please add them in the comment section, and later on in this conversation, we will address them. Thank you, Dr. Gray. We'll bring you back for Q&A. I want to bring in Dr. Collins, who is with Family and Community Medicine. Dr. Collins, won't you join in this conversation and talk a little bit about ways that families can keep themselves safe, their family members safe? What can we do? And also talk a little bit about the vaccine.
Absolutely. Thank you so much for doing this. Before I begin, again, I'm Dr. Millard Collins. I'm the chair and associate professor in the Department of Family and Community Medicine, and I'm a Meharrian. I've been at Meharry more than half my life. And, before I begin, I must say that very proud of this moment in history. I couldn't be proud of Dr. Gray as my colleague and friend. She risked her life, as well as my other colleagues at Meharry, every day to go out there and to make sure that others are well. And Dr. Kim for what she does, not just in PEDS, but probably more importantly in this context in the world of public health. She can't shake both those hats, and she wears them both with pride and with competence. I think the time has come for Meharry to really do what we've been doing. And last but not least, I couldn't be proud of our president. He's not just our most visible person at the top of Meharry. He's also, for this moment, a world-renowned virologist and immunologist. And he's been, I hear my wife talk about how he's been able to basically simplify this so that the layperson can understand. Because let's just face it, when the experts disagree, the recommendations come out and they change weekly, the ignorant are free to choose. And we're seeing this happen amongst many as they try to go back to work, and they have different barriers that come up that keeps Dr. Gray and the team busy at the assessment sites. A couple of things to think about while we're trying to combat this disease. Remember, there is no cure for this. Even though we see some of the more fluent folks in Washington get in and out of the hospital pretty quickly, there are many people who do have unrelenting and asymptomatic courses. It gives a lot of people pause and say, well, this isn't that bad. But it's very, very hard to ignore the morbidity and mortality affiliated with this disease. I saw a stat the other day that the top deadliest days in the United States, 4 of the top 8 were this past week. I'm just going to let that sit for somewhere, for a moment. But we're not here to just focus on the doom and gloom. We also want to tell you some things that we can do. As mentioned in this holiday season, we all have a tendency to want to come together and fellowship and love on each other. But unfortunately, at this point in time, it does come with a cost. I believe in testing, but there's nothing therapeutic about a test. By the time you get the test, you've already known. So I tell all of my patients, all of my colleagues, all of my contacts that assume that you have it. Assume that the person next to you have it. And I think that puts everyone on guard because, prevention is much, much more preferred than cure. But when it comes down to fighting this disease, I think it's important that we do everything that we can to make sure that our immune system is vibrant and healthy as it can be. We can do certain things by making sure that we have appropriate sleep, eating healthy. You know how that goes during the holidays, but I think we must eat healthy. Vitamins, there's a lot of talk about vitamin C and zinc, but I think if you're eating healthy, you're getting a lot of vitamins. But if you take a multivitamin, that should be all that you need. Manage your stress. Stress also kneecaps your immune system and decreases your ability to fight off infection, and hydrate. most people, when they get it, you hear about, the GI symptoms, the respiratory symptoms. So they have a decreased capacity to take in. It's important that we front load. So hydration is very, very important. So what happens if you think you have caught the virus? Well, personally, I think we should have learned a lot from Italy and some of the other countries, that we don't just run to the doctor's office. We create a petri dish sort of an effect. And, what we've done at Meharry is we've pivoted. We have screenings at every port of entry, so that when someone comes in, we have the screening questions that aren't perfect. They aren't non-specific, but it does help to mitigate some of those unnecessary risks. So we want to try to limit the capacity for people who are in the clinic, and we've done that. But we've been taking advantage of what we thought was going to come later on down the lines, and that's the virtual platform. So telemedicine, whether it's an audio call or a televisit call, have been very, very instrumental in us to maintain contact with our patients, to manage those chronic diseases that can also help them to not succumb to this disease. The emergency room, especially in African-American populations where you go first and you worry about paying later, the lower socioeconomic populations, it's not a good idea. And I think what we've been seeing is a lot of urgent cares and other entities kind of decrease those barriers for folks to get care that they need. I think we need to also quarantine. I'm asked often what happens if someone in my family gets it. And you can look at it one of two ways. Me, I feel like if someone in my family gets it, I'm going to assume I have it, and I'm going to do all I can to take care of them. But even within your own homes, you already heard Dr. Gray mention, you have to be mindful of who's in your home in quarantine. Stay away, wear your mask. I have teenage daughters, and they both, want to go out and be with their friends. That's what kids do. But unfortunately, some kids lack the maturity to really be mindful at all times and really make themselves susceptible to catching disease. It's not a fault. It's just kind of the way it is. And I think that's why we're seeing everything go up. We've tried certain things to put our kids back in school because it's very, very tough on the kids at home, where school is the place where they actually get love, they get food, they get shelter, and they get the attention that they need. So it's been a very, very trying time, not just for the kids, but also the parents. I won't talk a whole lot about testing, but I will pivot to the vaccine. There's a lot of misconceptions about vaccinations, and we all know what happened, years ago with Tuskegee. But I'm here to tell you that we must get beyond Tuskegee. We have to. Many of us don't participate in pharmaceutical trials. So the first time that many people of color are receiving these medications are actually from their physicians after they're FDA approved, still not knowing the effects it's going to have on us. And yet we use these things as excuses to not want to get the vaccine. So I want to be as clear as I can be. I've already RSVP'd to receive my vaccine during the first batch, as being on the front lines, and I will be receiving the vaccine, not just because I think it's the right thing to do, but I think it gives me a certain kind of credibility to kind of tell my patient, you should also get it. I've gotten it. And I think that's where we need to go with this. As Dr. Hilder just said, vaccines don't save lives, vaccinations do. And while we're caught up in what might happen, let's keep that same energy as it pertains to protecting ourselves and our privacy when we're on Instagram and TikTok and some of these other platforms where we seem to not really care about some of the side effects. When you talk about solutions, one last thing I do want to mention, we've had a lot of crises over the past few years. We've had crises with the opioid crisis. Now we're in the midst of the corona crisis. Here, for me, it's pulled a Band-Aid off of the healthcare disparities crisis that we've all known, and one of the many reasons that Meharry exists, and we fight every day. It's not easy to care for individuals who have many afflictions, but we're here and we've been doing it since 1876, and we're going to continue to do so. But I think now it's important that institutions such as Meharry stand and rise and tell the authorities that they need to put their financial resources and all other kind of leverages, just like they did with those other crises, to make sure that people of color continue to live and see another day. Thank you.
Wow, thank you so much, Dr. Collins. And again, we will bring you back for Q&A later on in this conversation. Dr. Kim, she's been here all year with us, a trusted voice. Dr. Kim, let me bring you in to come and share a little bit about how we can take care of our children during the holidays.
Well, good afternoon, and thank you to your team, Rev and Scarritt Bennett, for keeping this on the forefront. It is important, and it has been an honor to be able to come back often to kind of add some information, especially as we talk about children. Meharry Pediatrics is the advocates for kids. All children are our children, and we take care of them as if they were our own children. So we take the health of Nashville's kids and our Black and brown babies and all of our babies very, very seriously. And so if you're in need of healthcare, please come and see us. And so as we talk about COVID, we know, and we've always heard that children are less likely to get infected, especially if they're under 10 years of age or so. But that doesn't mean that we lower our guards. The jury is still out as far as whether and how much kids are super spreaders if they actually do get the virus. And the thing with kids is because they tend to do pretty well is you often don't know when kids are infected. We've seen this working with college age students that are going about their business, maybe with a little stuffy nose, but guess what? I also have allergies, or maybe a little bit of headache, but I've been up all night studying, or I'm tired, but I'm a college student, and thinking that all of their symptoms are due to what's happening in their life, when actually they're infected with COVID and are surprised when their test comes back positive. So it's very important that we do these universal precautions, regardless of whether or not we think or believe someone is infected or not. When we think of the issue of our kids, especially as the severity of COVID, more children actually die from infant mortality, Black babies from infant mortality than do from COVID right now. Okay. So there are many, many things when we say COVID, 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 but there are things that we have to do to make sure that all of our babies are healthy in and around COVID. COVID will be solved. We will get ahead of COVID. This too shall pass. But the things that are in place, as Dr. Collins was saying earlier, that put our children at risk are not going to go away unless we address them all within the same time frame. So as was mentioned, we think about our kids. Health, overall health before COVID, health after COVID is key. For children who have chronic diseases like asthma, like diabetes, like immunosuppressant, like any kind of heart disease, even our kids who are overweight and obese become more at risk, not just for COVID, but for many health disparities that we see showing up in the early adolescent or even during childhood, and put them at risk for being some of those adults that those family doctor people take care of later on with the health disparities that they are seeing. And the ones we're saying, beware, beware, you have hypertension, you have diabetes, you have this, all of those things we're seeing starting as children. So it's important that we keep our kids healthy from the get-go. And what does that mean? As Dr. Collins said, it means eating well. It means skipping the fast food, and as we say, all the inflammatory foods, the things that the body don't recognize as nutrition because it's so processed, and eating more of those fresh fruits and vegetables. And yes, supplementing with a daily age-appropriate vitamin. Why? Because our food is just not as healthy as it used to be, especially looking at vitamin C. And there are studies that show that because we don't go outside and never get in the sun, that low levels of vitamin D may also be a risk factor for COVID. So making sure that we're eating well and making sure our kids are nutritious. Kids can't eat what parents don't buy and cook. Let me say it again. Kids cannot eat what parents do not buy and cook. So it is a parent's responsibility to make sure that their children are eating well. Issues of sleep. I've seen way too many little people in the clinic because school is out and they're sleeping and going to bed at 3, 2, 4 o'clock in the morning and up all night and not getting adequate sleep because school still starts at 8, even if means all you have to do is roll out of bed and get in front of your computer. But they're not getting enough sleep, and that chronic fatigue puts you at risk for getting sick and possibly for COVID also. That gets into the issue of screen time. And long after COVID is gone, the issue of this generation spending way too much time in front of, as Dr. Collins said, TikTok and Facebook and Twitter and Snapchat and everything else is going to be a longer term effect than COVID will in general. So just the smallest things that allow us or allow our children to be healthy. If you're a cook, learn how to cook with garlic, learn how to cook with more turmeric, some more ginger, and some other things can also help to boost the immune system, along with, as Dr. Collins said, stay hydrated, making sure you're drinking that water. So if we can keep our kids healthy, then we're in a good stage, because not only are we setting them up for health now, but for health future. And that'll be a good way that hopefully we'll be able to eventually get our kids back to school. If a child does get infected, and are being cared for at home, because most children, as we said, tend to do well, it is still important that if they have a positive test, that they are isolating still for those 10 days. Isolating meaning that you're at home, minimal contacts. Yes, you're taking care of your kids, but you're not having friends and other relatives interacting, to try to decrease the spread. If you've just been around someone else who tested positive, it's quarantining, okay, which means you're still at home for 14 days. The CDC is in the process of changing some of those requirements if you have access to getting tested in that 14 days, like a day around 7 or so. If you have a negative test, you might be able to decrease that quarantine. Why? Because the average person who does get infected is going to start to show some symptoms within those first 7 days or so. But that's, that's still, they're still in the process of changing that. So how do we keep our kids safe? The same way that we keep the adults safe. Make sure that you have your face covering on, okay? Face covers have been found to be safe for hours and hours and hours, all right? Make sure you're washing your face covering often. My daughter has a habit of sneezing, and I look inside her mask and it's nasty. And it's like, can we wash this? So keeping your face covers clean, making sure the social distancing, trying to keep especially a tween who lives for their cohort, lives for their friends, from hugging and being in the space of their friends is extremely, extremely difficult. And it really takes that parent kind of putting that into place to be able to keep them apart, per se. And that gets us to the idea of what's going to happen with school. In-person learning is so important for our kids and for this generation. And the longer our kids stay out of school, the farther behind there is the potential of them falling as far as educational attainment. So it is very important that we figure out how to send our kids back to school safely. And I have to, kudos to Dr. Battle and to the Metro schools, because they have been working so hard trying to figure out what is the best way to take care of our kids. And I trust the decisions they're making. I may not always like them, but because I want I want the education, but I trust it and I support the very thoughtful way that they are looking at reopening schools. I have 2 Metro school students that I'm raising. And so it is important, definitely important for me, as it is for all the kids that I take care of in clinic, that they get back in school when it is appropriate. Kids that are in person, besides being access to the academics, they online, their curriculum is slimmed down. The classes, the days are shorter, the amount of information that they are covering is shorter, and the curriculum is actually different than what the kids normally do. There's definitely less engagement for them, and children who are at risk are slipping through the cracks. And that is what is most concerning about that. And, when we start looking at some of the standardized testing results, maybe we'll start realizing this and see what's going to have to be put in place for these kids. Dr. Collins mentioned the importance of social aspects, social and emotional, not just skills, but fulfillment that kids get from being in school, from being with their cohort or their posse, as I call it. And that is extremely important for development. For the developmental stages of pediatric, the access to support services, whether they are mental health, and I know that Tammy's going to talk about that, but learning help for students with special ed or any kind of developmental disabilities that need those supports that they get in school, access to healthy meals for kids. There are children, as we know, that if you're not in school getting free breakfast and free lunch, you don't eat. And the schools have been working on trying to send home food packets and backpacks, but it's, it's questionable whether or not that does what is, if it's as successful as being in school, doing the best that we can given the circumstances, but also wellness checks. If the teacher is looking at you every day, there's a good chance if something's going on, they're going to know about it. Somebody's going to know about it. When you're a child that nobody has seen in 9 months, if you're in a high risk household, if you're in a dangerous situation, there's no outlet. There's no one looking, seeing you in school. Sometimes, or most of the time, the kids have their cameras off. So you don't know. So I worry about our babies that have not been seen for long periods of time. The bottom line, about 1 out of every 5 children who are doing virtual learning right now is failing or not doing well, whether it's computer, whether it's internet, whether it's interaction, whether it's just their needs, they're not doing well. So we got to get our kids back in school. And over the holidays, I'm sure the schools will continue their process of looking at how do they do social distancing, face mask procedures, maximizing the use of space that they have. How do they do hand washing? How do they move people around, moving teachers instead of moving students from class to class? How do you feed people in school? All of these things, which are major undertakings for the school. But I think one of the most important things for us as a community, if and when the schools are able to open back up, is that we, and I'll say we as parents, take the serious responsibility of not, capital N-O-T, not sending our kids to school sick. All right. It is not about drop a dose of Tylenol and send them to school. All right. Thinking, well, they won't be febrile while they're there. And then, the nurse will call, but it'll be time to go. Please don't do this. We're putting the entire district at risk if we continue to do this. I know the tricks. I'm a parent too, but making sure that sick children are at home, symptomatic children are at home, to give the schools the best opportunity to stay open as they can. There's not a recommendation right now that everybody has to get tested to go back to school from the CDC. Why? Because that tells you if you're positive at that particular moment. And as Dr. Gray said, she gets tested often, because you may be negative now, but in 2 minutes after that test, you could have been exposed. So it's giving a lot of false senses of security, saying, oh, well, I tested negative. Well, you tested negative 2 weeks ago. There's been a lot of exposure since then. But the idea of doing the daily temperatures and the parental adherence to staying at home when you're sick is key. So bottom line, we have to do what we need to do as parents, as adults, to take care of ourselves, our families, and our neighbors, so that we can start to, 2021 as a new world. I joke around, and if you're a Christmas movie person, we've just experienced, Christmas future from the Christmas Carol. And this is we've experienced 9 months of what the world could look like if we do not do A, B, and C. So now we've seen what it could look like and how bad it can be. It's time to go back to Christmas present and do the things that we have learned from looking at the future, so that we can be in a different place come this time next year. So as I said, if your children need to be seen, let us know. Meharry, we've been taking care of kids for over 100 years, and we will continue to do that.
Thank you so much, Dr. Kim, and we'll bring you back again for Q&A later in this conversation. And finally, we have Tammy Hines, who will come and talk about mental health. And Tammy, I talked to you earlier this week. It was hard. We were playing phone tag. Part of it is you so busy, because this is a very vulnerable season for many who suffer with mental health. So I want to bring you in, talk a little bit about who you are, talk a little bit about your practice. But if you would talk a little bit about holiday blues. Again, a lot of people have experienced loss and are grieving during the holidays, and the way the holidays in many ways can make our mental health status vulnerable. Welcome, Tammy.
Thank you so much. This is definitely a topic that I look forward to talking about. My name is Tammy Hines. I'm a licensed psychotherapist. I was born, raised, and educated in the state of Tennessee. My alma mater is Tennessee State University. About 4 years ago, I opened up my private practice, Bellevue Behavioral Health Group. And we see a diverse group of people, even though my target audience are Black and Brown people. One of the things that I strategically did is I accept all insurances and even Medicaid, so that no one has to be turned away. I do work on a sliding fee scale, and I don't turn people away because of inability to pay. So let's talk about the holiday blues. Who would have known that COVID would rush through this nation like it did? A pandemic. How has that affected all of us? Everybody has been depressed and anxious. And Black people, I'm sorry, but we are the first to call it life when it's really trauma. We are the first to say, this is just what I have to do to make it, and try to not address it. And when we don't address things, it builds up. If it's one thing I want you to hear today is, I love to say this quote because it's so true. Everybody has physical health. Everybody does not have physical illness. Everybody has mental health. Everybody does not have mental illness. So what does that mean? Your mental health is just as important as the physical health. It's just that physical health, we probably can identify it a little more quickly than mental health. Because again, remember, we're calling it just life. What are some of the things that you can look for when trying to decide whether or not you need to go see somebody about mental health? Well, at the very least, how often do we go get a physical? At least once per year, regardless. Schools require for children. Jobs will require it. If you plan sports, it's required. Some doctors might offer some information about mental health, but a lot of them don't. So let's just run down the list of signs that you might encounter when you're talking about mental health. You may have difficulty eating, difficulty sleeping. You might have a difficulty concentrating, inability to focus, feelings of loneliness. You might be isolating. Well, when we say you might be isolating, that's kind of hard to do right now because we are mostly all in the house with each other. Have you somewhere that you can go off, to be alone? If you work from home, it would be great if you had an office where you can shut the door, or had your work where you can put it away so that you can get a breather from work and school life. Statistics are showing that the divorce rates are going up, suicide rates are going up, depression rates are going up. I remember waking up one day and looking at the TV, and I saw that one of the doctors on the front lines had completed suicide. And that was just really, really shocking to me. But it made me understand that this is something that we have never experienced before, not in our lifetime. And it is something that we really need to take seriously. If it is something that is lasting for 2 or more weeks, I would urge you to go get yourself checked. Coming to see someone like me is not saying that you are crazy. It is not saying that you are mentally ill. It's saying that you care about yourself and your children. It's saying that you care about your job and your community. I think when people first come to see me, number one, they tend to want to see someone who looks like them. It's a lot of therapists who look like me and you that are willing to work with you. And it is difficult to go to someone who doesn't. I sit down with people and I talk to them because I've been where they've been. Not too long ago, I had my first client whose family member died of COVID. It was really sad. I sat and I cried with my client because that's what was needed at that time. I have had my nephew, he has COVID. Talked on the phone to my mother, who's 70, so she's at risk. So it seems like the more we get into the year, the more this is going to happen to people we actually know, and it's no longer a number on the TV. And when it's no longer a number on the TV, that's where we need to come in and say, maybe this is more serious than we think it is, because it is. If you are not, well, one of the things that we are all going through is some financial difficulties, and the funds just can't come quick enough. One of the things, I have clients, I help them find resources, and I can't keep up enough resources for rental assistance, food, evictions, because even though those laws are out there, people are still getting evicted, right? So what are some things that we can look for if you're exhausted because you had to pick up another job? If you are strained of dealing with family members, because generally when we went to work, that was our time away from family. It's not like we don't love our family, but it was our time to say, whew, I don't have to think about my family. And now you got to yell, I'm on the phone, I'm at work, you know, and all of that happens. And that's just the reality of what we're living with today. Most of us hadn't even thought about a support system, but we have poor support systems. If it's one thing that I will say, it may not be a medicatable issue. It may be you need some more people in your corner. Therapy is treatment. Everybody that comes to see me doesn't need to take a medication. But I do have that conversation with people when I feel like medication and therapy are the best options for them. And the reason I will say this and mention it, that we have such difficulty with people wanting to take psychiatric medications, is because, and I have 3 doctors on here. So unlike the flu, it's certain things that'll treat that and then you're done. Psychiatric medications are a little bit differently. Sometimes you have to go in 2 or 3 times to get the dosage right, to get the med right, you know, to make sure everything doesn't, you know, add up to everybody. And so that's why I have the conversation. We can walk this walk together. Financially, we are all going through a lot. But let me just say this. Hold on. Help is coming. And we are fighting. This is a justice organization and I'm an advocate. But if you need to get some help, please get some help today. My organization does not turn away people. I refer out and we will help. So that is what I have to say about the mental health piece with this COVID. One last thing that I want to say. One of the things that we always do is we say we are fine. It's okay not to be fine. It's really okay to say, I don't have food in my house. It's really okay to say, I need help. And for some reason, we don't feel like it's okay, but it is. Please reach out to people. Reach out to people. We are all in this together, and we are going to come out of this. Turn off your TV. We get so much stress coming from keeping the TV on 24/7. Yes, you have to keep abreast with the latest information, but we don't have to sit there and watch it for 8, 9, 10 hours a day. I haven't turned on CNN in 2 weeks and I feel wonderful. I only watch the first 15 minutes of my local news station and I feel wonderful. I take a step back from social media and I feel wonderful. And that's one thing that you can just take off your back. Be creative with the kids. I think a lot of times kids get bored. And like I think someone said, learn how to cook with, teach your kids how to cook, have fun games, step out the box of what you normally do. Because if you're feeling like this, imagine what your kids are feeling. They have mental health too. They have stressors too. And we're all in this together. So just think about that. And I'm gonna stop right there and take some questions.
Awesome. That was great. Thank you so much for that information. And yes, I want to move to the Q&A section of this conversation. And I want to start with the vaccine. There's so many conversations about the vaccine. And from a racial justice perspective, our work at Scarritt Bennett Center is be co-conspirators. I want to go ahead and name that, particularly in the Black community, there is a distrust in the sciences in the medical field because of the trauma that we've experienced from those particular fields. So when it comes to vaccines, when it comes to having to take the flu shot, we don't do that. We're not the ones on the first line to do it. I went to the doctors the other day. My doctor asked me if I wanted to take the flu shot, and I said no. Part of it was because of the history that I've experienced. The history that I hold on to around the trauma. Nothing personal, just the generational history, right? If we can name that. And I'll be honest, there's a lot of conversations in the Black community about whether we should take this vaccine or not. So I want to offer an opportunity for each of you from your own professional experience, but also your social location. As a Black woman, a Black man, talk to the community about ways that we can manage the trauma. Tammy, I want to start with you because this is I think this is part of the racial trauma issue in our community. So let's start with you in terms of how we manage, right, this generational trauma so that we might move forward, so that we're doing a communal act in taking this vaccine. You're on mute.
There we go. So one of the things I will say related to this is, I think like Dr. Collins said with the Tuskegee experiment, it was a horrible way to treat Black people. Mm-hmm. But what we've done out of that is IRB was created. We've gotten information. Black people are more and more involved in medicine. We have to educate ourselves, right? And we can't just listen to what other people say. It is sad that Black people are the last to sign up for, these studies. But understand they are kept under strict supervision. And I would hope to say, and somebody else can back me up, that the Tuskegee experiment wouldn't be able to happen today.
Dr. Collins, I want to bring you in specifically around how, Meharry, the Meharry Medical College at HBCU, but a Black scientist like Dr. Hildred, who's at the table making decisions. You mentioned earlier that there's a Black woman who's at the forefront of this work. So come on and talk a little bit about, like Tammy said, the difference between then and now, and talk to the community about why we need to do our part in taking this vaccine.
Absolutely. I think sometimes we handicap ourselves holding on to the past conveniently, drawing our own conclusions. So I don't know what any other way to be than clear about this. Again, vaccines don't save lives, vaccinations do. Dr. Corbett is lead NIH scientist who's taking the lead with Moderna. Our president, Dr. James E.K. Hildreth, has been on the forefront locally and now nationally, working with the FDA, approving this. And he was on CNN, 2-3 nights ago, and he said, you know what? We've looked at this, and by far the benefits outweigh the risk. 95% effective is this Pfizer vaccine. So Pfizer and Moderna, very reputable names in this. As Tammy mentioned, IRB and the practices that have happened because of Tuskegee, it doesn't happen anymore. But here's the reality of it. Ideally, every person of color can go to a physician who's of color. But despite when I came to medical school, it was 5% of the nation's physicians were people of color. It's still roughly around 5%. We can't do it alone. I think you're going to have to just develop a rapport and a trust with your personal physician, and that starts before the crisis. You see, I've been doing a lot of men's health conversations, and I talk to the brothers, and I ask all of them, how many of you have a car that you like? Or how many of you, get the oil change, every 3 months, and they're raising it, and they laugh and they're enjoying it. And then I say, how many of you go get your own tune-up and see your doctor? And they put their hand down. We need to treat our bodies the same way that we treat our prized possessions. And if you don't do it for yourself, because many of us, how many of us, kick that ball down the street and say, hey, I'm going to keep on doing what I'm doing because you have to go somehow. Dr. Gray said it best. I've heard Tammy and I heard Dr. Kim say it, do it for your kids, do it for your loved ones. I have 2 daughters that really I've committed myself as they grow older to make sure that I'm around for them to walk down the aisle and beyond. So we have to start taking care of ourselves as the leaders of the family, but we have to get around these excuses because that's what they become. Tuskegee was not last week. We know that there are many other evidences of some of the racial systemic racism, in this current climate with the civil unrest. But here we are amongst a once in a lifetime opportunity with this crisis. And you have a Black female with Moderna, and then our president, and then Meharry, and many of us standing tall to tell you that, hey, we're in this with you. Last thing I mentioned, and I can't applaud Dr. Gray and the team that's been out at all the assessment sites. I was on the fence about testing because, as I said, there's nothing therapeutic about a test. But when I was out there and I can see the fear on their faces kind of go away when they saw the Meharry Medical College name and they come in, and that's an opportunity for them to have some dialogue and be rest assured. What we're doing here today, I think, is a continuum of that. And, I'm not at liberty to get into too much detail, but I think we're on the cutting edge of a really novel concept where we're trying to raise all Black businesses in the healthcare industries, whether they're physicians, whether it's pharmaceuticals, whether there's lab, clinical trials, to come together so that we do have more options, because trust is key if we want to get the health outcomes that we seek.
Thank you. Yeah. Dr. Kim, particularly with children, why should we trust this vaccine with our children?
Okay, trying to get unmuted there. Well, just to start off, we've seen a decrease in the number of children that are up to date with their immunizations. And we know that immunizations and protection against vaccine preventable diseases is something that has changed the public health outcome for generations, between polio, and I'm sure that Dr. Collins probably has a similar story of being in the intensive care unit as a resident and having to take care of, for me, it was a 3-month-old that had meningitis from a vaccine preventable disease, and watching as that child slipped away from us because at some point there was nothing else we could do because that particular disease was just too bad. The child was too sick, and having to go into the next room and tell the parents that their child was not going to survive because of this preventable disease. And that's something that I never want to experience again. And it's nothing that I ever want a parent or a family to have to experience again, or even the community. So when we look at issues of measles, mumps, and rubella, and Haemophilus influenza, and varicella, and some of these diseases that have ravaged communities in the past, then we see what happens when science is trusted and we're able to do things like get a herd immunity against certain diseases. There are medical students now that have never even seen chickenpox. Why? Because we've done such a good job at vaccinating that we're not seeing the children in the ICU, the long-term effects of some of these diseases. So the fact that we are on the cusp of possibly adding another vaccine preventable disease to the list is something that should be celebrated. The community has all of the rights to embrace history and to be pessimistic and everything else about that. But with that comes education, and education leads to knowledge. And being able to look at the research, able to look at trusted individuals. If you trust your physician for a flu shot, most of us, not mentioning those up in the corner that haven't got their flu shot yet, not throwing any shade.
Trying to throw the shade.
If you trust your physician with toxic chemicals injected into your body to save your life from breast cancer, if you trust your physician for some of these things in the ICU when you have to be put to sleep and cut open, if you can trust your physician for some of those things, then if your physician talks to you and recommends that you get the vaccine, then why would that be any different than some of those other things? At some point, we have to believe that people are out for our best interest. And so as we look at the studies, as we look at the data, as we look at how children have responded to the vaccines, then we have to take all of that into consideration and make the best decisions for our family so that the community can get back to work, the kids can get back to school, and hopefully life as we know it can get back to some semblance of normal and not just this new normal that we've been told, well, this is just a new normal. It doesn't have to be. It doesn't have to be.
Yeah. Dr. Gray, you're in the front lines. Talk to the community in terms of why taking the vaccine should not even be a question. Talk to us.
Well, part of the reason that Meharry Medical College from the inception came to the forefront of this pandemic was simple, so that our community could help with the social injustices and the inequities that we suffer as Black and Brown and vulnerable populations. And the way that I see it, and I think we see it at Meharry, is the vaccine is absolutely no different. Taking this vaccine, it'll be widely available in the spring of 2021. We at Meharry are encouraging our general population to take it as soon as it becomes available to the general population, because of those same reasons. We want to make sure to protect our population that needs to be taken care of, to get people back to work, to get people back to school. We want to reduce those burdens. Some of what Dr. Collins and Dr. Kim and Tammy have already talked about. You mentioned the flu vaccine. Well, every day as people are coming who are symptomatic and being tested for COVID-19, some of those same influenza symptoms are mimic those of the coronavirus. So making sure that you're immunized will prevent you from loss of time from work. And it is very, very important for us to ensure moving forward that our community has a sense of confidence. I know myself as a healthcare worker, we as healthcare workers, and those that are in assisted living facilities will be amongst the first to get the virus. And I know as soon as it's afforded to me, I'm going to be amongst the first to take it. I believe in it. I know that if my President Hildreth, who, as Dr. Collins has said, is on the advisory committee, I know that I'm confident in its safe and effectiveness. And those are all reasons that it is most important that our communities take the vaccine once it becomes available.
Dr. Collins, you mentioned something earlier that I want to bring up. This idea that part of addressing this distrust is to build relationship with our doctors that we go to. Part of the fear, right, is also the lack of knowledge. So, and this is for anyone, but I'll start with you, Dr. Collins. What questions should we be asking our doctors about this vaccine so that we are equipped, we are well knowledgeable of it, so that we do feel a little bit more confident in taking it? What should we be asking our doctors about the vaccine when we go to see our doctors?
Frankly, do they have it? I mean, I think it's really that simple. You know, and Meharry, we were ready to give you your flu shot upon conclusion of this live stream, by the way. But really, it's that simple. I think that if we invest too much in being defensive about it and talking about, well, the microchips can't really fit in the syringe and all these things, I think we add too much validity to some of these nonsensical excuses. One thing I will mention is some people have said, well, why do we need 2 doses? 2 doses have to assure its efficacy. It's not uncommon when, you know, you get in the pediatric, and Dr. Kim can go and probably tell you much more, but the HPV vaccine is relatively new compared to some of the others that have been around for a while, and it has a series of doses. So having more than one administration should not add to the suspiciousness of it. But if people, the one thing that you should discuss with your physician is, why is this vaccine right for you? And I think the only way you can do that is if you know what you're currently dealing with, know your chronic disease status, know your state of health. And again, much of these questions are done better when we're not having in such crisis mode. So when I'm meeting my patients on a regular routine basis, for instance, I'm starting to talk to my patients once they have a chronic disease or once they have dependence about death and dying. I don't care if you're 30 or 40. I'm talking about, are you planning ahead while you still have all your faculties? So if we make it routine and not necessarily in response to a crisis, maybe just one day we can go from just trying to survive to actually thriving. But let's be clear, vaccinations are the cornerstone of public health, and it's a no-brainer for us, particularly knowing what we are susceptible to as people of color.
Yeah. Dr. Kim, I put it out there, so I'm going to go ahead and talk to you. The last time you were here with Dr. Hildred was really worried about flu season with this virus. So why should people like Reverend Charisma consider taking the flu shot? Talk to us a little bit about the flu shot. Why should we be taking it? Because a lot of us don't.
Mm-hmm. Well, first and foremost, to understand that the flu is deadly. The flu is when people say, oh, it's just like the flu. The flu is deadly. The flu kills thousands and thousands of people every year of all ages. It's not just an older individual. People get the flu. And if you've ever had a flu as an adult, you know, one of the first things people say is, man, that was rough. The flu, that was just worse than I thought. Yes, it is. And it kills people. And as Dr. Collins and Dr. Gray both said, a lot of the symptoms for flu mimic that of COVID. Okay. Now, just from the pure kind of, we'll say the histrionic standpoint, if you get symptoms and you're like, do I have the flu or do I have COVID? I personally would like to know that it's not, that it's not the flu. So I can at least start from what I need to be concerned about instead of, well, is it the flu or is it COVID? We protect ourselves against the things that we can protect ourselves about. And as I said, first you do all of your health maintenance, all of the things that you as an individual can do to keep yourself healthy. We can't always control when we are exposed to something, and then we take it to the next level as far as plan B. But in order to limit the chances of death and of confusion with COVID, it's important to get your flu shot. Get my flu shot every year. I don't know if might not be able to say that on screen, but if you haven't got your flu shot and you get it at Publix, you get a $10 gift card. I got flu shots and we went shopping. It was wonderful. So you have to make sure that you are protecting yourselves, doing the things that you can do, and limiting the flu. We don't know what kind of flu season this is going to be. We usually don't know until hindsight and say, man, that was a really bad flu season. We can predict about what kind of flu season it's going to be, but there's no way to say for sure. The flu loves it when people are huddled together inside. So the fact that a lot of people are social distancing and sheltering in place, if they were doing it all the time, that may actually decrease flu, but people have to work, people are still going in and out, and then they're bringing those infections home to their cohort and potentially spreading it. So if you haven't got your flu shot, Rev.
I hear you. I
As
hear
Dr.
you.
Collins said, tomorrow morning, first thing, he can make sure you get a flu shot. Okay.
I
We have
hear
to do what we can do.
You're making me a believer, Doc. I hear you. I hear you. A question from the audience, and any one of you can take this. I haven't heard much lately about wiping down delivery boxes, papers, etc. The focus has been on interpersonal contact. With so many deliveries now, should we still be wiping them with disinfectant or leaving them in isolation for a few days? So the preventative measures, there's been a lot of conversation early on this year about preventative measures. Is it still the same? Has it changed? So much of the narrative have changed. So are we still wiping down objects? Are we still, we've talked a lot about washing our hands, but what about the objects that we get from supermarket and public spaces? What are the preventative measures?
I'll throw it out there. I think that prevention is always the right thing to do. We don't really know, and as much as we think we know, so many people have gotten this coronavirus already. Yet numbers continuing to surge. My point is I don't know if people are getting it again. Are they still testing positive? We don't know. We don't know if this is a mutated disease. We don't know. So until we do know, we need to act like we do. And if there's not just the wiping it down, I think there's some pretty cool technologies and they're pretty affordable. The ultraviolet lights that people are using can sometimes help to decontaminate and sterilize our belongings. But personally, I don't wipe down my grocery bags per se. Again, I try to, and I don't want people to misunderstand. This is just my personal opinion. I really focus on the fact that imagine what Dr. Gray mentioned at the very beginning. Respiratory droplets is how we get this disease. That's human contact. It's usually how we get it. There are theories that it dies, after so many minutes or hours on inanimate objects. But there's also other theories that say that it just hangs around in the air for days. We're going to respect the virus. I think we're going to do the best that we can. But clearly, if you have someone who is at increased risk of dying from this disease, I think you should be even that much more cautious. But wiping it down in ultraviolet resources that they have to kind of decontaminate your stuff is still advised.
Yeah.
Okay. And if you have access to, a garage or something like that, just open your Amazon package and leave the box in the garage. Make it easier. You can't protect against what you don't know, so you protect against everything, and you go from there. I still wipe down my shopping cart when I go to the supermarket. I bring my groceries inside. So it's whatever you need to do to make yourself feel comfortable until the science is 100% documented and verified.
And you can never be too cautious. I mentioned earlier when I spoke about just your shoes. You never know what's at the bottom of your shoes. So walking in the house and leaving your shoes at the door, that's just a practice that my family uses. We mentioned grocery bags. I just choose not to take my grocery bags and put them on my kitchen counter. They go on the floor and we take our groceries out and put them on the counter. Even after that, we wipe our kitchen counters down. They're just small practices that we use around our home because, again, like my colleagues have shared, there's just so much about this virus that we're not aware of, and we are just extra cautious because I do have an elderly parent who lives in the house, and we have been very blessed and fortunate to have protected her all this time and want to continue to do so.
Yeah.
And from the mental health point of that is, don't become too anxious. Don't become too, oh my goodness, oh my goodness, oh my goodness. Do what you can when you can to protect yourself, but don't let it go overboard that you are just spazzing out over everything.
That's good. Yeah, that's good. That's good. Another question from the audience. I had a conversation with a friend recently about why she's choosing to travel during the holidays. She knows the virus is surging and that the risk of getting it or giving it is high. But she said, we know so much more about this virus than we did in March, and treatment is way better than it used to be. In other words, she figured she'd be more likely to survive if she did end up in the hospital with a severe case. So the exposure risk was worth it. I didn't know what to say to this. Is this true? Is it safer to get the virus now than it was 6 months ago? And let me say, there's a lot of people who are thinking this way.
Well, let me say something first before the doctors step in.
Yes, please do.
So I do critical incident stress management, where I go out to emergency visits. Let's just say somebody got robbed, somebody died on the job. And one of my placements was at a hospital on the COVID unit. And when you see the people who are in ICU on the COVID unit, it will hit you differently. When you have doctors and nurses who have a coworker who were working the COVID unit, caught COVID, was in ICU and passed away, it hits you different. When you see nurses and doctors having to strap up and put on gear just to enter a room of a patient, it hits you different. This is ludicrous. It's putting unnecessary stress on an already stressed system.
Thank you for saying this, and I'll let my physician speak in a minute, but I want to speak to this. We do know more about the virus. However, by no stretch of the imagination are we in any position right now to let our guard down. If anything, we're in a more dangerous place than we've ever been. Our hospitals are overburdened. Our physicians, our nurses are at their wits' end right now. I've even seen and heard, as this vaccine is being distributed, that physicians and nurses are coming in and even offering on their days off, and some of them don't even have days off, to administer the vaccine. The surge capacity, and surge capacity just means the maximum capacity that a hospital can have before its system is overburdened. We're not at a place where people should be traveling. The CDC issued something during Thanksgiving and asked that people not travel for Thanksgiving. Unfortunately, at the testing centers, we had our highest peak during that time of testing. And it's not rocket science. It is just because people, as I very well know, you saw the television, those of you who were watching television, the airports were packed. People were defying the CDC guidelines. They were traveling. As I mentioned earlier, we are bracing for the holidays now as we come up to the Christmas season, Kwanzaa, your religious belief, whatever your religious belief is, you have to understand that we have to be most vigilant right now. This is the last time that we need to think that it is carte blanche for us to be able to start traveling. There's a lot of hard work that's been done, and we are at a point when we can have our numbers decrease as opposed to have our numbers increase. And I will just say that it pains my heart to see the amount of work, time, attention, and energy. And Dr. Collins mentioned this earlier about fear. We've not had any fear. We as Meharryans, I'm a loyal Meharryan. I'm a 1999 graduate. And we as Meharryans, our team has been at the forefront of this pandemic. My dean, we have all been at the forefront of this pandemic since its inception. We are not fearful, but what I am fearful of, I will tell you this, I am fearful that people are not being socially responsible. That is what I'm fearful of right now. And our hospitals cannot handle it. And I am passionate. So I implore anybody who's listening to please be mindful of that. I love my family. I have dear family members. I'm from the great state of Texas. My children are Tennesseans, but I will not be traveling to Texas, and none of my family will be traveling here. And I implore anyone who's listening to please be mindful of that, because we are not on the other side of this pandemic by any stretch of the imagination.
And I add just to the folk that are thinking of that, have that mindset that it's better to get it now than it was 6 months ago. The virus hasn't changed. We know a lot more about the virus now, how to care for it, what are the stages of illness, what therapies work the best than we did 6 months ago, but it is no less deadly, no less traumatizing than it was then. For anybody that thinks that they are in a position to receive the same treatment that President Trump did, that he said, oh, it's not that bad, this, I feel wonderful. You hate to put it frankly, but you ain't gonna get it. It's not available widespread. For the hundreds of thousands of people that are in the hospital right now, that therapy is not available. So yes, we know a lot more about it. We know some of the things that can help, but the virus is no less deadly now than it was 6 or 9 months ago. So to have the kind of the I don't want to call out your folk, but the audacity to think that it is better to get this virus now than it was before is just a very unfortunate way of thinking. It is better not to get the virus at all, period. And that means, as Dr. Gray said, making sure that we're doing our part and making those sacrifices. I thought the quote that said, social distance now and celebrate Christmas versus, celebrate Thanksgiving and, spend Christmas in the ICU. It's just there, we just have to put things on pause for a minute until we can get back to a point when we can see our families and those who are more vulnerable safely.
Can I add with this question, Dr. Collins? I know you want to come because we're focusing about the holidays and people traveling, but I really want to kind of bring this attention to the everyday, right? So going to the restaurants and, I'm a single girl, it's been hard this year, but I'm just always amazed how folks want to meet up and let's meet up. And I'm like, there's a virus out here, right? And so the lack of kind of urgency to stay safe. People are still wanting to meet up for happy hour and go out to restaurants. And there are times I've gone to, a store and people don't have their masks on. So I think it's not just travel, Dr. Collins, it's the everyday ways in which we're not really doing our parts. Can you talk about that? People really do think that because, we've had this for 10 months, we know a little bit more about it. So we don't really need to, right? Talk a little bit about that.
You're spot on. That's exactly where I was going to take this. I mean, the twisted justification that we just heard that they must know more is human tendencies, right? It's been going on for so long. It's pretty outside. It's the holidays. We kind of choose to believe what we want to believe. But a couple points, and I think that'll bring this home. We're talking about Thanksgiving and people coming together and the risk. There's a zip code, 37130. And that's in Antioch, where it's a lot of Black and brown people, also known as a hot spot. We know that this is the effects of gentrification, where many people have been pushed out to more affordable places of living, and they've been living under these conditions for months, and they are getting sick and they are dying because they are in close quarters. So why would we want to put ourselves in harm's way by doing that, especially for an enemy that we can't see? I think that we need to be smart about this, and we need to push just a little bit longer. I think some of us are, and I don't want to make this political or racial, but there's the haves and the have-nots. And sometimes, the haves tend to think that the exceptionalism known as America, we can do this. And Dr. Kim just explained it. Some people just going to get certain things that others will not get. And that's just the way it's always been. But I wish that this country would act like the greatest country in the world and protect its people and stop playing politics. The last thing I want to mention is something Dr. Gray mentioned about fear. The thing about fear is, as a human, as a father, as a husband, there's nothing worse than watching a loved one, suffer. And there's nothing that I can do about it, whether I'm a physician or not. I had the honor and privilege of helping a Black-owned hospice company is coming to Nashville. I don't know if I can say the name of it, Heart and Soul Hospice. They'll be going live. And one of the things in early 2021, one of the things that we talked about was during this COVID experience, so many people, especially people of color, have been dying alone. I can't tell you the number of people who have said their loved ones have gone into the hospital and how they're doing. I don't know. They aren't telling me anything, only to find out that they died. We heard about bodies being stacked up in trailers because it's just so many people. And I think people are losing that sense of humanity. But I think if we get some true leadership in January 20th or so, whenever that time comes, maybe we can change the narrative and just realize that it's during these times that we must come together. But it's during these times that you're experiencing your training, we'll hope to mitigate fear. So we are trained professionals. Don't try this at home. But everyone tends to go into business to themselves. But that's, I don't want to, like Dr. Kim, I don't want to say too much about the question that was asked, but we must avoid these twisted justifications just to do what we want to do. It won't end well for someone.
Dr. Collins, if you would put the information about the hospice in the chat so we can add that so our audience can have that information. We like to give as much resources as possible to our audience members. There's another question from the audience. Tammy, I'm gonna start with you because it was directed to you, but I want to open it up to everyone. We've talked a lot about preventative measures. I'd like to talk a little bit about what happens when you do get COVID-19 and ways that you can gain support from doctors and nurses, and some of that is through telehealth. Dr. Tammy, the question is, do you offer telehealth? Could you start first telling the people what telehealth is, and then talk a little bit about your practice? Do you offer that, ways that people can get in contact with you? And then I want to open it up to the other doctors to talk about telehealth. Why is that a measure in terms of how to stay in contact with your doctors when you need it, specifically when you have COVID-19 and the hospitals are full and you want to be able to get in contact with your doctor? Start with you, Tammy.
So telehealth is virtual. Who would have known that this would be the preferred method? But it is a way for you to get on some of your computer devices and virtually see your practitioner or your mental health professional or your healthcare professional without actually being in person. So currently I do 3 days of telehealth or virtual sessions, and I do 2 days in the office. With the spurge coming on, that, tends to, last week I did all of them virtual. So I do need people to be cognizant of the dangers and are willing to work with me. But for the most part, I do both. But telehealth is an excellent way to get in front of a professional and still get your needs met.
Thank you. The other doctors, can you share a little bit about how patients can stay in contact with their doctors through telehealth and what Meharry offer?
Well, I can say that from the pediatrics, Meharry has embraced telehealth early on. We talk to patients on a daily basis and are actually in the process of incorporating group education for pregnant and newly parenting families to be able to do group visits. In that sense, also we'll be starting group nutrition visits, group developmental and behavioral health visits, just as ways to increase the opportunities for the information that you need while we are in this telehealth. But for the one-on-one, there is always the opportunity to call to schedule an appointment with your provider on a one-on-one basis. Or if you're not feeling well or wondering whether or not your appointment is can be done telehealth, to get that evaluation and then to be scheduled for an appointment with your provider. During the surge, one of the things that we want to make sure of is, one, that we don't miss any of our routine care, because again, staying healthy during this time is key, but also for kids and teens that may be mildly ill, that need to, the reassurance that they're okay, but doesn't necessarily need to be done in the office, that we can take care of those individuals also and limit everybody's risks.
Dr. Collins, I'm single. I'm in the house by myself. God forbid I get the flu or COVID-19. My hospitals are full. What can I do to get in contact or stay in contact with the doctor to get the instructions I need to be well?
You know, Meharry has been debulking our lines, even the internal lines. So we have a very simple line for your audience and yourself to take advantage of, and it's 615-327-MD4U. Now
Say
the thing
that
about,
again slowly, we got to catch that. Say that again and slowly.
now I'm definitely gonna put it down, 615-327-MD4U. The thing about telemedicine, we always thought it was going to be in the future, right? But there's this phenomenon in healthcare known as the triage. And experienced healthcare providers, whether it's a nurse or a provider, can pretty much help to discern exactly what your patient has. You know, we practice evidence-based medicine, and we ask them a series of routine questions to help you decide if this is an acute issue that we can treat, or if it's something a little bit more urgent that you might need to increase your level of intervention, whether going to the emergency room or coming in for laboratory investigation. But for the simple things, such as, you know, I think I have an ear infection, my sinuses are acting up, or what do I do about, you know, I think I have COVID, I'm going to tell you stay home. So especially if you live alone. That was the advice that we were telling people, you know, before. But now people are tending to do this reverse engineering process where they do what they do, and then they go and get tested by Dr. Gray's centers and hope that they're negative. This is kind of different. But telemedicine is available, 327-MD4U. Ask, now it's preferable that you are an established patient, because now we have a baseline. And the telemedicine rules were that, and telemedicine was around before then, but since COVID has come, they have allowed us to receive new patients via telemedicine, mainly just as a precaution. So I would encourage everyone to take advantage and call.
Yeah.
And I just want to piggyback off of what Dr. Collins said. For those that do come to get tested, it is very important that you self-quarantine until you get your results. And there are resources available on the discharge instructions. There are resources available by the health department. There's a 1-800 number. There's a grant by the Tennessee Department of Health that patients can call if they have tested positive, to talk about resources, to talk about ways to help them as they self-quarantine for the next series of days if they are symptomatic. So it's very important until patients get those test results back. It's up to 3 to 5 days if they do come to any of our community assessment centers that they do self-quarantine. It is not the practice to come and get a test and then go back and re-enter into the work environment or into the school environment, to whatever that environment is. Because if you are infectious, even if you don't know that you're infectious, you could then be potentially infecting other people. And that's very important for us to realize and to be accountable for. Social responsibility is very, very important.
Dr. Gray, would you recommend home kit testing? Talk a little bit about the home testing kits that's available.
I'm not very familiar with the home testing kits. I know that several people have taken the home testing kits. I don't know how reliable and how valid those testing kits are. And so I don't really want to speak to that. But I know that they are available for public use.
Tammy, could you talk a little bit about mental health symptoms? What kind of symptoms should family members be paying attention to as it relates to depression and those who are grieving, holiday blues? It's easier to kind of figure out the physical symptoms, but mental health is a different one. Would you talk a little bit about symptoms we should be aware of as it relates to mental health?
So we look at frequency, intensity, duration, and onset. That's one of the ways that we determine whether or not. So if you're at home and you're not enjoying some of the things you used to enjoy, that could be a sign. If you're used to having one glass of wine and now you're having 3, that may be a sign. If you're used to sleeping 8 hours a day and now you're only able to sleep 2 hours, or you're having trouble falling asleep, can't stay asleep, or you're eating too much. See, the reason why you need to get in front of a professional is because a lot of these can mimic a lot of stuff.
Yeah.
Right? And with us going through everything that the world is going through right now, why wouldn't you be depressed? Why wouldn't you be anxious? Why wouldn't you have these symptoms? And those are the reasons why I would encourage, if it's outside of your norm, because a lot of us are used to struggling, but we hadn't struggled like this, right? So if it's outside of what you're used to doing, then that's probably, it's nothing wrong with just saying, I don't know, can I come in and see you? And a lot of times just sitting there, we just like, I'll just say, let me hear what's going on. And before you know it, you're feeling better. That is treatment that I don't think people understand. That's the treatment. You can't talk about everything to everybody. And I know we called it the holiday blues, but that's a fancy name of just saying, I'm not myself.
Yeah.
I don't feel good. We like to dress things up, and it ain't pretty.
Yeah. And this is the season where suicide rates go up. Particularly, I used to work, background is in higher ed. We get worried about our college students in this season. So talk a little bit about ways parents, adults can be paying attention. And Dr. Kim, you can jump in this too, paying attention to children's behavior and what things, symptoms that parents should be paying attention to as it relates to children, teenagers, and even college students.
So go ahead, Dr. Kim.
Talk about mental health and then I can talk about go ahead, start.
So the suicide rates are going up. Parents need to talk to their children. We need to look at our children because some children will cut and we don't even know it. Cutting is not exactly saying I want to kill myself, but it is an indicator that there are some problems. If your child isolates from you, I don't know why we let children go in their room for days and shut the door without any interaction with family. Talk to your children, ask your children what's going on. Because here and now, they aren't going to school, so teachers aren't able to step in. We've relied on teachers to do some of that, right? So a lot of times when we talk about suicide, it's one of those things that I don't think is that we don't want to talk about it, we just don't know how to talk about it, but this is how you talk about it. Are you feeling okay? Are you feeling like you want to hurt yourself? Have you thought about suicide? That's the way we talk about it.
And I think that's important. Family, and I'm sure Tammy is seeing this also, families are under a lot of stress. As was mentioned earlier, work used to be a refuge away from family. And now the 24/7, 365 times 9 months is a lot of time. You joke around and say we've exhausted all quality time at this point because things start to get a little bit old at this point. A lot of families are dealing with the boomerang kids. They've been gone. Now they're back. They're back from college because they're learning online. They're back from living on their own because they can't afford it. They've lost jobs, they've lost homes, they've lost other things. And there's a lot of stress going on with that. And the holidays don't make it any better in that sense. For the younger kids we mentioned earlier, we're seeing that, especially the 11, 12, 13-year-old girls are showing signs of early depression from that isolation and being away from their friends. One important thing is, I think, for families to remember the reason for the season. And just because you're at home, it gives you a lot of opportunities to do for others. It doesn't take a lot. You have construction paper, make cards for elderly individuals and drop them off at someplace. My daughter is making something that we're going to give out in pediatric clinic. Do something to show that you are part of the community that's easy, doesn't take a lot of resources, but it reminds you that this is a collective, and it does tie it back to the reason for the season. And it's just an opportunity to teach and realize it's not about the gifts, but what can you give to others during this time, especially folk that may be isolated or may not, or you know that they don't have their family around. Then, you know, I think the best quote I've seen in the last 9 months is, just be a good human.
Mm,
Be a good human,
mm.
and do what you can in that sense. It giving especially children that sense of importance, of connectedness, is something that can go a long way with their mental health.
Thank
And
you.
also just teaching them to give back. I know community service has helped me, and there's not many opportunities right now, but pick up the phone and call somebody who you've not called in a long time. Actually hear their voice.
Mhm.
You have elderly neighbors on the street, mask up, go over there, just say hi.
Mhm.
I mean, it's certain things that we can do to contribute to a better society.
Mhm.
That
There was
doesn't,
a family, and I just thought this was wonderful. I saw that, they went Christmas caroling in the neighborhood. They ring the doorbell, go back 20 feet and sing a song, and then just go on to the next house. And it was completely social distance. There was, no additional risk there, but it gave them the opportunity to bring a little bit of joy to the community. I just thought that was just such a wonderful opportunity to give back. You want to sing with the people that you've been living with because of that chance of, spreading those respiratory droplets, but still remembering that this is so much bigger than just yourself, and just use it as an opportunity. And for parents, it's also a great time to be able to teach some Black history, because here you go, you're homeschooling, teach between the lines.
That's right. Thinking outside of the box. Listen, I'm looking at the time. I am always grateful for our partnership with Meharry Medical College. And I want to read a comment from one of the audience members who says, I wasn't going to take it, referring to the vaccine. Now I am rethinking this. I still don't think the testing was long enough. I'm old enough to remember polo, and I realize science is better and faster, yet still the testing needs to be a bit longer. However, the amount of people who have died makes my heart break. This is why we do what we do, because we are in the business of shifting and changing minds. Y'all got me wanting to go take a flu shot, all that. And I think part of this conversation, Tammy, is to normalize the importance of taking care of our mental health. The last time I talked to my therapist, I said, I need a new therapist, a Black woman who understands what it means to be a Black woman. So Tammy, I'm gonna call you this week. Normalizing what it means to, right? You're gonna get a call from me this week, Miss Tammy. And so I wanna say thank you to each and every one of you for all the ways you show, for who you are and how you show up in the community, the service you provide. And as we end this session, I wanna offer you an opportunity to share words of encouragement, words of wisdom. We already done changed somebody's mind about the vaccine. Come on, and let's offer some words of wisdom during the holidays with COVID-19. And I'm going to start with you, Dr. Julia Gray, who's doing testing. Won't you offer words of wisdom as we leave this space?
Thank you. I enjoyed our talk today. I think my words of wisdom are simple. I stated them earlier. This is what I tell our team every day. Please be kind, do good, love all. We do that each and every day as we practice our simple rules of social responsibility, loving mankind by being vigilant against this virus and washing our hands, wearing our mask, and social distancing. If you love everyone and do so, you will find ways, unique ways during this holiday season to give to others and follow our mission, which is, of course, worship of God through service to mankind. I wish each and every one of you a happy holiday season. And remember my mantra, our mantra, which is be kind, do good, and love all. Thank
Dr.
you.
Julia Gray, we're so grateful for you. Thank you. Dr. Kim, won't you offer words of wisdom as we leave this space?
I think one of my favorite quotes is that there can be no rainbow without the cloud and the storms. So as we go through this stormy period, realize there's always going to be something better on the other side of it, the post-COVID, we can say. But the other part of that is that he or she that does not understand or know their history is destined to repeat it. So if we don't take what we've learned in 2020 and use it towards being better humans in 2021, then we're at risk of this happening again. This is not going to be the only pandemic. We live in a borderless world. This is one example of possibly other things to come. And once we know how to identify, how to address, and how to work together to minimize the effect of it, then we'll be better off in the future.
Dr. Kim, we're so grateful for you and all the ways that you show up in the world. Really appreciate your words of wisdom. Dr. Collins, you got me wanting to come take a flu shot now. Come on and offer words of wisdom.
Make me want to come to you with the flu shot before you change your mind. I'll talk to you about that offline. We have a saying in my fraternity is the difficult we do now, the impossible takes but a second longer. I think we're almost there. Reverend, I'd like to thank you before I forget for having me participate in this wonderful platform where I can talk amongst colleagues. Julie, you and I go way back. You line sisters with my wife. You've got my brother and my sister out of dental school, and for that I'm very, very thankful. But you remind me that at Meharry we train much more than just School of Medicine or School of Dentistry. You're out there as a leader, as an advocate, and I'm very, very proud of what you're doing and who you are. You'll have my prayers. Dr. Kim, been knowing you for a while, and then we kind of went through the health coaching experience, and I saw different layers of you, but you're always thinking. You use humor, but you're one of the most generous people I've ever met. You give a lot of your time and yourself, not just to the kids, which is a very special population, but in public health, something that intimidates me, but you seem to take it all in stride. So in your new role as the lead of that division, I offer you my continued support. And Tammy, you don't think I remember you, but we go way back with the Black-owned FQHC many, many years ago. And I'm very, very humbled to see you still fighting a good fight, because there's not enough providers in this space. What I will say in leaving is that, this is a pandemic, something that we've never seen before, but we're reminded about the resilience of human beings. We can really, really adapt to any of our situations. And I encourage all of you to just think a little bit differently and just stay safe. During these difficult times is when we see some of the ugly sides of the world and the things that happen, but it also could be a blessing when we see the best that mankind has to offer. So I'm optimistic that this will have a good ending, and we just need to continue, but it starts with getting your vaccines. Thank you.
Thank you, Dr. Collins. And we put information about Heart and Soul Hospice in our comments and hope to get more information about that in the future. Tammy Hines, come on and give us words of wisdom as it relates to mental health.
A family doesn't need to be perfect. It just needs to be united. And we are all a big family. I don't care how we look at it. And we all need to support. I'm sitting on giants today. I'm really happy to have been here to share just a little bit of knowledge and encouragement to somebody out there. But the reality of it is we cannot take care of our mental health. We cannot take care of our physical health without taking care of our mental health, right? So I just want you to know there are practitioners out there that look like you. And we are booked and busy, but we can make room for you. Thank you.
Tammy Hines, thank you so much. We are grateful for you all for joining us. We've had a great run this year. This is our last live stream conversation in 2020, and we're grateful. We started with Meharry, and we're grateful to end with Meharry. And we want to say to you, each of you, regardless of where you are this year, regardless of how many people you're around, our goal, our hope for you is that you're making making wise decisions. You are being safe, not just for yourself, but for your neighbor, because we are communal beings, and how you treat your neighbor matters always, but especially in this season. So go forth this year. Happy holidays. God bless you, and we hope to see you in the new year. Bye-bye.